Agmatine is an exciting new supplement. I say new, but it's been around for a while in pre-workout supplements for its ability to initiate a muscle pump effect or vasodilation effect, where the your blood vessels get wider and more blood passages or more blood flows to the muscles that are being worked out. It has a lot of benefits. That does short-term and long-term benefits while you're in the gym and for muscle growth thereafter, and the triggering of anabolic processes, etc. But where the previous ingredient of choice for muscle pumps was probably citrulline or citrulline malate, but where citrulline would need 6 to 8 grams per dose prior to a workout, you only need about 500 milligrams of agmatine. So citrulline would be almost a scoop in and of itself in your pre-workout supplement, but agmatine is sort of a tenth or a twelfth of that amount. So it looks good for the muscle pump effect, but there's some interesting sort of preliminary evidence coming out about agmatine in the scientific world, from research and development and clinical trials with people and stuff like that. And the first one, it doesn't affect as many people as those that go to the gym, but agmatine for pain reduction. Now, this isn't a sort of all points pain reliever or anything like that, but it's rather specific to a particular pain, which is related to something called lumbar radiculopathy, which is where the discs in your spinal column, have been in some way injured, compressed, and that they're pressing on the nerve. A lot of people would call that sciatica pain, but sciatica is related more to muscle affecting the nerves or trapping the nerves, whereas this is an actual physical, mechanical thing with the skeletal structure itself, the disc itself, where it's compressed and it's touching on the nerve. So agmatine looks very much like a promising therapy for people with that specific pain. So if that's something that you suffer from, then look further into agmatine. Maybe talk to your doctor about it. Moving on to agmatine as an anti-depressant. Now this is really interesting. In one study so far, so it's by no means proven beyond the scale of doubt, but this single study showed that three people who were suffering from depression went completely into remission from their depressive symptoms. So that really is one to look out for in the future as a cheaper and potentially safer form of antidepressive medication or alternative medicine. Again, how to use it there, we're looking at the dosage pre-workout and so on and so forth. Just go into our website there and read more about it and compare it to citrulline malate. There's less evidence for agmatine compared to citrulline malate for the muscle performance, but it's looking promising. Dosage wise, again, 500 milligrams looks like a good start, and pretty much shouldn't really go much higher. So it looks like 750 milligrams was used in a couple of the studies there, and it looks really safe as well at those dosages. Certainly, no side effects. But again, there's not much research data out there, so more research, more clinical trials with people, and we'll get some more robust data about agmatine.